Hello and welcome to HARDtalk. I'm Shaun Ley. Get ready is the message from health experts fighting the coronavirus COVID-19. At least 80,000 people are already infected in more than 40 countries, and that number is expected to rise. My guest today is David Heymann, Professor of Infectious Disease Epidemiology at the London School of Hygiene and Tropical Medicine. He's among those advising the World Health Organization on its response to the coronavirus. Is the organisation moving quickly enough, or are powerful countries slowing the WHO's response this time? And will the price be paid by those unlucky enough to get sick? Professor David Heymann, welcome to HARDtalk. Do you think it is on the point of becoming a pandemic?
Well, you know, the word pandemic is really a distracting word because it means different things to different people. What needs to be done is countries need to do their own risk assessment and decide what they can do best, whether it's to lock down the virus in small outbreaks or to begin strategies that would be in place should it begin to spread wider in the community.
In what way do you think this word is unhelpful? Because a lot of people have regarded this as simply a way of defining the worldwide spread of a disease, making the point that it is simultaneously in different places, and that can kind of trigger an international response. Well,
there are several reasons. First of all, the WHO uses the term public health emergency of international concern, and they've already called this an emergency of international concern.
But they did wait until the 30th of January to do it.
They waited,
and think that perhaps it should have been a bit sooner.
They waited until they had the evidence they felt was necessary to make the recommendation. But now that it is looking like it's spreading in outbreaks, at least worldwide, and possibly could spread into the communities, there won't be a change in what's going on now if the word pandemic is used.
The US Centers for Disease Control and Prevention, where you once worked for many years, thinks a pandemic is now likely. Dr. Anne Schuchat, speaking in the last few days, said it's not a question of if, it's a question of when and how many people will be infected. So some in the kind of what one might call their public health industry find the word of value because it helps them identify the scale of the challenge they face.
That's right. And if you think of when the pandemic of influenza was announced in 2009, it changed nothing. The response was the same. Countries have preparedness plans. They put those plans into operation. And right now, the word pandemic could actually mean that countries stop trying to lock down the virus in outbreaks and prevent a rapid spread into the country if it's so destined to do that. So the word pandemic may have connotations that actually backfire.
So is it fair to say that this has been discussed by the World Health Organization? It's not that they haven't looked at that, they have actually engaged and considered whether it would be useful and have effectively said, no, it's no use?
Well, that's not exactly the case. Yesterday there was a discussion in an advisory group that I chair. We talked about the usefulness of declaring a pandemic, and we asked for the criteria that would be used to announce that pandemic. But at the same time, we talked about possible confusion between the public health emergency that's already been announced and also about the strategies that countries should use in deciding how to deal with this virus.
But this is a question a bit more than just nomenclature, isn't it? That I heard exactly the sort of argument you were being made by a public health expert on the radio in the last few days. Because it does have a direct impact. Rory Stewart, who's a former British International Development Secretary, said until the global pandemic is declared, you can't release the World Bank funds so that poorer countries can actually put the processes in place to be able to deal with the spread of this virus. So this decision could actually impede the response in some parts of the world.
It could, but the committee that I chair is actually a committee that works closely with the Pandemic Emergency Fund at the World Bank. And we're working to be sure that funding is made available when it's needed. And now it's needed in many developing countries.
So you're saying to the World Bank, forget the word, it's not what matters. What matters is what's happening on the ground.
Well, that's not our job to do. What we do is make recommendations, and then they make their decision. The recommendation would be to clarify what the difference is between a public health emergency and a pandemic, and when funds should be released.
See, that takes us back to the same problem, doesn't it? If they still need to clarify that, and the word isn't being used, the funds are not being released.
It's absolutely right, and we're working to make sure that those funds are released.
So this is a live issue at the moment. I mean, you spent the first, 12 years of your career as a medical epidemiologist, some of the poorest countries in the world, India, then countries in sub-Saharan Africa, Cameroon, Cote d'Ivoire, Malawi, and what is now the DRC. Surely they need this help now if they're going to be in a position to protect their populations from this potential spread of this very serious illness.
Well, actually, they needed the funds in advance.
Right.
And that's the whole problem with international development aid and the Pandemic Emergency Fund. Funding should be made available to countries. Governments should be committed in those countries to use those funds to develop the capacities they need to detect and respond and prevent international spread.
Detection, this is a really important point. At the end of January, you'll know this better than I do. I was genuinely taken aback when somebody at the World Health Organization told me this in a radio interview. In sub-Saharan Africa, there were just 2 countries in the whole of the continent that could test for this. Senegal, at the Pasteur Institute, and South Africa. That's an illustration, isn't it, of how essential it is that the money is made available quickly. Because if you can't test for it, you don't know if you've got it. If you don't know if you've got it, you don't know how far it's spread. If you don't know how far it's spread, you have no chance of containing it.
Absolutely. And yesterday we saw a map that showed that every country now in sub-Saharan Africa has had training and has established a center that they can do the analysis of the nucleic acids to better understand what's going on. So there has been funds available, and those funds have been used to strengthen capacities through the Africa Center for Disease Control and the WHO Regional Office in Africa.
What do you think of the World Health Organization's response thus far?
I think it's been a very solid response from the beginning, and what the WHO is doing is networking epidemiologists, clinicians, and virologists who are working at sites of outbreak and others to understand what's necessary to treat patients, what the best successive treatments is. Epidemiologists working together have understood how the disease is spread from person to person, close social contact, and health worker infections. And it also understands the sequence of infection versus disease. So there are many things that are understood. But what's not yet understood is the transmissibility. How easily will this virus transmit in the community?
And that must raise concerns for you and other experts about whether the advice thus far, which has been to isolate for 2 weeks, is actually effective. Because we have seen a number of instances. The most obvious one was the Diamond Princess, the cruise ship off Japan, where the timescale implied is that this disease may actually be active for much longer than 2 weeks.
That's right. It's still not clear what the maximum period of incubation is for this virus, and that's very, very important to understand. And also there's a lot of information out there that suggests that the virus might be transmissible just before symptoms begin, not when you're asymptomatic, but just as you're developing symptoms. And there's been evidence of that in Germany, for example, when a woman who was developing symptoms took a medication which decreased her fever, but permitted her to spread anyway the infection.
I go back to this question of the speed of response, because it's very striking. We've talked about this emerging sometime in December in China. It's the end of January before this global emergency is declared by the World Health Organization. There was some pressure to go sooner, but that is what has happened. And there are those who think that this solid response, to use your word, is actually a cautious response, which may be fine, but given the way things are developing, may not actually be adequate.
Well, certainly the response that China has done is within their capacity to do. It's been a whole government reaction to this virus. By stopping flights going out of the area where the outbreak epicenter is, actually they've delayed the arrival of cases in other countries. So that's been shown through epidemiological modeling to have been effective. They've done other things that have also permitted the rest of the world to get ready.
So a bit more time.
They've helped us buy time.
What about the World Health Organization, though? Some might say too cautious, too political. And I say that not with a capital P, but with a small p. The Secretary General, Mr. Ghebreyesus, is a former health minister in Ethiopia. It's not unusual for politicians to end up doing this job, and he's obviously got medical background as well. But I wonder if there's a danger that that mitigates against a willingness to be potentially confrontational when it comes to the crunch. And this is such a big issue that actually a bit of banging heads together might sometimes be necessary.
Yeah, well, the World Health Organization is a political organization. It's an organization made of member states, of 194 member states, so it is a political organization. There's also a technical response capacity within WHO, and that technical response capacity has been moving forward steadily since the beginning of the outbreak has been announced.
In 2003, working at the World Health Organization, you led the global response to SARS, the severe acute respiratory syndrome. I mean, is that fair to say that's kind of, it's of the same family as COVID-19? Broadly, it's a similar sort of respiratory infection.
Absolutely, it's the same type of virus. However, the SARS coronavirus, from understanding about the virus, is low in the respiratory system, where this coronavirus, COVID-19, is high in the respiratory system. Greater risk that it could be transmitted by droplets.
So physically higher is what you mean?
Physically
so
higher,
come out.
yes,
Yeah.
and also able to spread possibly more easily in a cough or a sneeze.
Because there we had this SARS outbreak, which effectively affected about 8,000 plus people, led to over 750 deaths. We're already up to 80,000 people infected, we believe, as far as it's possible to know. Thankfully, nothing like the same scale of fatalities, but still significant numbers of deaths. And yet, the contrast between the WHO's response then and now is striking. I mean, I was reading an article you wrote back in 2013, reflecting on events of 10 years before, where you talked to the case of a doctor who'd been treating patients with this mystery illness, taken ill on a flight home, and as you wrote, within 2 hours we were urgently reassessing the evidence. Later that same morning we presented a summary to the then Director General of the WHO, Gro Harlem Brundtland. Quickly comprehending the urgency, Brundtland that morning issued an unambiguous call for health authorities worldwide to work together to stop the disease in its tracks. I say again, has the response this time not been a bit too solid, a bit too cautious?
Well, this is a much different situation from what we understand. SARS virus occurred from 1 or 2 events from animals to humans, causing an infection, and a few chains of transmission that became amplified in hospital settings when health workers got infected. This outbreak, from what we understand, started explosively, with many, many people infected at the same time, many, many different chains of transmission created, going into families where the majority of transmission appears to have occurred.
Doesn't that mean then that the response should be appropriately more urgent if you're talking about, as you said, an explosion of infection as opposed to a much more controlled and measured rate of infection?
Well, you know, countries report when they want to report, and China reported when it felt it had the evidence that it should have to report. Since then, there's been quite active participation of China in providing information on a daily basis to the World Health Organization, and also in providing other evidence that's necessary, including permitting a team of international experts to go in and sort out some of the information with them.
Not everyone is impressed by the work of the World Health Organization. The United States government is planning to cut its funding by 53%. What will be the impact of that?
Well, that means that they're planning to decrease their external funding, which is outside of the normal assessed contribution that the WHO gives. So they will decrease their funding according to what's been said. That will certainly have an impact on the programs at the World Health Organization that they support. But usually they support individual programs and not generic activities within the organization.
So you're not that worried by that decision?
I'm very worried. I think that every country should continue to contribute to their maximum possibility to the World Health Organization, which is the only agency that can help us coordinate a response such as is going on now with the SARS outbreak.
Even though
the coronavirus outbreak.
Even President Trump, though, seems to think that this is a problem that is going to go away because the weather's going to get warmer as spring arrives, and that will solve the problem for us.
Well, I haven't seen that evidence, and the virus is transmitting very well in Singapore, which is a very tropical and warm climate. So if the evidence can be presented, then I will believe it, but until I see the evidence, I don't believe what's been said.
You mentioned the Chinese government. You said they presented the evidence when they thought it was the right moment they had the evidence. There are less charitable views of what the Chinese did. And Rory Stewart, the former International Development Secretary I've mentioned before for the UK government, says that the decision by the World Health Organization to call the global health emergency at the end of January and not sooner was purely for political reasons, the desire not to offend the Chinese government. What do you make of that?
Well, I make that some people believe that, and that some people are promulgating that idea. I don't say it's right. I don't say it's wrong. What I say is that we've got to pull together now and make sure that we do what we can to contain and stop international spread of this outbreak if possible.
Isn't the problem with this that this kind of approach which says let's not offend the Chinese, we want them to cooperate, that you've been here before, you were here with SARS, and at the time there were problems. It took a prominent doctor. China, for example, failed to notify the WHO until February, several months after the virus was discovered. As you know, it had emerged in 2002. And then it took a prominent doctor in 2003, April of that year, to accuse Beijing of covering up the true number of infections. Only then did we start to see accurate reporting of numbers. In other words, unless the Chinese government, and there may be other governments of which this is true, but we'll talk about China since that's where it emerged, unless the Chinese government is pushed into it, it will not voluntarily provide that information. And inadequate statistics mean you make misjudgments.
Yeah, I look at it in a more positive manner. In 2003, during the SARS outbreak, it wasn't actually until Gro Harlem Brundtland, the Director General, accused China publicly of not providing information that information began to flow. This time that hasn't been necessary. The information has flowed, and the information continues to flow with a team that just got back yesterday and talked about the knowledge that they've gained from their travel to China.
Yeah, you wrote, Brundtland spoke openly about China's reluctance to publicly discuss the duration, scale and evolution of SARS within its borders, and successfully encouraged Chinese officials to air the details and to work with the rest of the world to stop the outbreak. So in that sense, she did that, and it had that desirable effect. Your argument appears to be that China has already acted voluntarily. Really?
I think China did act voluntarily. Nobody forced them to report this. Nobody knew about the outbreak outside of China, and China then did report it. Why they reported it, I can't say. Why they didn't report it sooner, I don't know.
The young doctor who died, who was one of those who did try to report it, found himself effectively told to sign a letter. Li Wenliang, this is, you'll know to whom I refer, letter colleagues at the end of in December that he had found a number of these cases. He was then summoned to the Public Security Bureau, told to sign a letter, accused of making false comments that had severely disturbed the social order, warned that if he did it again, he would be brought to justice, and he wrote underneath, yes, I do understand that. That's not the attitude of a country that wants to share information, is it, about a potentially disastrous worldwide health crisis that is starting in its backyard?
Well, at that point in time, it seems that they weren't ready to report it. That's right, and it's a shame because this was an ophthalmologist who also became infected, probably from close contact with a patient, and died.
What was lost then, apart from his life and others presumably, what was lost by them not acting sooner and sharing this information?
Well,
do you think, as an epidemiologist?
I can't look backwards. All I can say is that when these outbreaks occur, it's very important to get on them as soon as you can and to understand how they're transmitting and understand the ease with which they might.
See, I take you back to this point again about what Gro Harlem Brundtland did as Director General of the WHO, and that perhaps has been absent here, that confrontational approach. Not for the sake of confrontation, not for the sake of grandstanding, but it's an argument for saying that we are in the middle of such a severe crisis. You have public opinion on your side in terms of mobilising everything this planet can do to try and prevent this turning into a more serious crisis than it already is. Isn't that the one time when you can say to those countries, embarrass them, use the bully pulpit, expose them to whatever ignominy is necessary internationally to get them to cooperate? If you pussy a foot with the Chinese or with the Iranians or anyone else, they carry on as they've always carried on, and you try and do it when there isn't a crisis going on, there's no incentive. This is the incentive. This is the moment.
Well, if the Director General knew that this was occurring, that there had been an outbreak and that it was being suppressed, then I would have thought that the Director General would actually say, we know about this outbreak, we want to learn more.
So in other words, the WHO didn't know this was happening?
I do not know whether they knew or not.
Have you ever asked that question?
No, I've not asked that question because what I'm interested in is today. We have to move forward. We have to get this under control if we can.
But don't you know from SARS that what happens today may provide you with the lessons for the next time?
I'm sure it will. I'm sure it will provide many of them.
So perhaps these questions will at some point need to be asked.
They may be, yeah.
Okay.
They may be useful.
In Iran, President Rouhani has promised transparency on numbers. This is another country which is facing a significant outbreak. But he's then told his cabinet colleagues we shouldn't let America mount a new virus on top of coronavirus that is called extreme fear. The Americans themselves are struggling with coronavirus. In other words, this all gets into politics. It gets in the way of actually tackling the problem.
The politics do get in the way, and what's fortunate is that politics haven't impeded the technical cooperation going on. I myself spoke with the director of the Public Health Institute in Iran yesterday, so I know what's going on there. Our advisory groups know what's going on there, and we're confident that we have the information we need.
Have you seen the video of the Deputy Health Minister, Iraj Harichi, from, I think it was Monday of this week, standing next to the government spokesman Ali Rabiah, who's a familiar face on Iranian television, at a news conference in which, whilst Mr. Rabiah is speaking, the minister is standing next to him, sweating profusely, constantly dabbing his head with his handkerchief, looking not very well. Have you seen that video?
I haven't seen
it.
No.
Well, it might be worth looking at, because in the words of James Longman at ABC News, this would be funny if it wasn't so serious. The guy on the left is Iran's Deputy Health Minister. He has coronavirus, as we subsequently learned. He's suffering here. The guy on the right is the government spokesman. He's literally saying there's nothing to worry about. That's the problem, is it? Beautifully summed up by that image. Mm-hmm. Governments that don't want to frighten or panic their public, perhaps, as you said, the WHO didn't want to panic the public and therefore held back from advertising this crisis and saying it was a global emergency of global health concern earlier than the 30th of January. But actually, meantime, people are getting infected. Not only are people infected, some are dying. And that kind of caution, that kind of politics, whether it's the WHO or whether it's individual governments, ultimately costs lives.
I can't agree more with you on that, and this is late in the outbreak, and there should be transparency in every country about what's going on and where the outbreaks are occurring.
What lessons do you draw from what's happened so far in tackling what's to come?
What I've learned is that politics sometimes get in the way of outbreak containment and response, but there's always a technical team that's working, and technical areas in health are a way that the whole world can work together to stop a disease. In the 1970s, the world worked together, Russia, the US, everyone together, to stop smallpox, to eradicate smallpox. Despite the geopolitical
operation at the time,
despite the geopolitical tensions that were occurring, the world accomplished a public health goal. Health is a good way of working together technically that overcomes geopolitical differences.
What do you think is our prospect of being able to contain this virus, COVID-19, and of actually being able to eventually treat it?
Well, it depends on several factors, and the one factor that we don't understand is the transmissibility, how easily it transmits from human to human. Once we understand that, predictions can be made. We can only say from epidemiological modeling that if the reproductive rate or the possibility of transmissibility is high, there will be a widespread community involvement. And
right now it is high.
Right now, involvement seems to be mainly in very close contacts, in families and in health workers and others. 82% approximately of cases in China are from close family contact. That's not community spread, that's household spread and hospital spread.
Professor David Heymann, thank you very much for being with us on Hard Talk.